Well, good morning. In 2021, a visionary idea took root in our city. We asked ourselves, what if the city of Los Angeles provided $1,000 direct, no strings attached, payments to some of our most vulnerable Angelenos? Specifically, individuals with dependent children or those who were pregnant at the time and who had been financially or medically impacted by COVID-19. And so a bold and compassionate pilot program aimed at uplifting our neighbors was born. My office proposed this groundbreaking poverty alleviation initiative with an initial investment of over $6 million for Council District 9. With the support of working families and my colleagues, including Councilmember Marquise Harris-Dawson and others, and with the support of then Mayor Garcetti, that program increased to $40 million citywide. More than 3,200 households received monthly installments for 1 year beginning in 2022, making it the largest initiative of its kind in the country. And I'm told that the $1,000 was the largest amount of any program in the country. Today we have the results from the Center for Guaranteed Income Research at the University of Pennsylvania, and the data speaks for itself. Researchers found positive trends in financial well-being, food security, parenting, sense of community, and reducing intimate partner violence and the fear of community violence. But we witnessed transformation in the participants that went beyond data. Big Leap didn't just help them address health issues, school expenses, child care, or emergency needs. It also empowered participants to start businesses, to move into their own homes, and to reclaim their hope from despair. The undeniable impact of programs like Big Leap speaks volumes, and it has the power to rewrite destinies, and it is vital for creating a brighter future. So we can't stop here. We have to continue on. We have full momentum. That's why this morning, alongside my colleagues Harris-Dawson and Soto-Martínez, we were introducing a motion to do another $4 or $5 million guaranteed basic income program, specifically targeting this time individuals experiencing intimate partner violence, domestic violence, or those transitional age youth. Our funding, of this funding, I'll be dedicating $1 million from my own discretionary funds to address individuals experiencing homelessness in our district. And given the stories and the data that this report has provided, we know that those experiencing intimate partner violence is an important population to serve. And we will move forward. We will guarantee income has the ability to break cycles of poverty. That's been proven, to break cycles of poverty and housing insecurity. And these are issues that have plagued our region for decades. And now we have research to show that it can be alleviated. But now it's my honor to introduce my colleague, another champion of the people and a believer in the guaranteed income movement, Honorable Hugo Soto-Martínez from Council District 13. Councilman?
Thank you so much, Councilmember Price, for that wonderful synopsis of all the incredible benefits that this program has shown in the city of Los Angeles, and for always leading on this issue. You're champion for working people, for fighting against income inequality, and so much more. I also want to thank Councilmember Harris-Dawson, who's not with us here today, but was also a participant of this amazing program. And this could not have been possible without the amazing General Manager, Abigail Marquez, and the entire CIFD team who's here behind me, and the researchers and participants who made this possible, which is the largest study with a lot of results, that it was a city-led guaranteed income program. Now, this program has shown us something extraordinary. It has proven that when we come together as a city and prioritize the needs of the most vulnerable among us, we can create real transformative change. GBI tested a revolutionary idea that actually wasn't so revolutionary, and that's that when we put money in struggling families' pockets, it might actually help them. We know that this can happen if folks get a union job or get a different higher income, but it also means that when we give folks a guaranteed basic income, it also helps them out. And guess what? It actually worked. Families were able to put healthy food on the table. Parents can sign their kids up for sports teams. Workers could quit dead-end jobs and look for something better, something with a future. But most importantly, it showed that it kept families together. It had gave people the ability to thrive and be their fullest selves here in the city of Los Angeles. And that's what happens when we put people first. Because this is about confronting the root causes of inequality and an economic system that prioritizes corporate profits over human lives. A story that many of us know too well here in the city of Los Angeles. And the stories we're going to hear today remind us of why we're in this fight. Because if we can make policies that put people first and ensure that everyone can live without the constant stress of financial insecurity, we can build a fair and more just city. So lo que este estudio ha presentado es de cuando les damos un poquito más dinero a las familias, ellos pueden cambiar sus vidas totalmente. Lo que este estudio enseñó es de que las personas con hijos tuvieron más tiempo para estar con ellos. Muchas personas pudieron salirse de violencia doméstica. El estrés que la gente confronta en esta ciudad bajó. Entonces, no es una idea radical que cuando la gente tiene más dinero en su bolsillo, pueden tener una vida más agradable, más salud, con mucho más amor y mantener sus familias juntas. Entonces, quiero agradecer mucho el trabajo que ha hecho el concejal Price y también el concejal Harris Dawson, la gerente general Abigail Marcus y todo su equipo y todas las personas que hicieron este estudio en la Universidad de Pennsylvania. Porque lo que esto demuestra es que cuando la ciudad de Los Ángeles crea pólizas que centran a las personas, que centran a los trabajadores de la ciudad, podemos tener una ciudad mucho más justa y mucho más saludable para todas las personas que hacen esta ciudad trabajar. So thank you so much. And as Councilmember Price mentioned earlier, today we will be I will be very happy to co-sign a motion that will create another GBI program here in the city of Los Angeles that's focusing on intimate partner violence and many of the transitional age youth here in the city. And I will be also contributing $1 million of my discretionary funds to make sure that that happens. Because we got to continue this work. We know this is not going to be a one-time thing. We got to continue to fight, and I'm happy to carry on the legacy of much of the work that has been done here in the city in the past. Thank you so much.
Thank you, Councilmember, and thank you for putting your money where your mouth is. $1 million bucks, you heard it, right? Now it's my honor to introduce a real shero in our community, a real warrior. In fact, she and her team have worked on a number of poverty alleviation measures over the past several years, and especially this Guaranteed Basic Income Program. The General Manager for Community Investment for Families and Community Investment Families Department, I should say, the Honorable Abigail Marquez.
Thank you, Councilmember Price. Very, very kind words. I want to start by thanking you again, Councilmember, for your leadership and your compassion, and to your staff. Many of them are here today, especially Marissa Alcaraz, who's the Deputy Chief of Staff for the Councilmember, for the collective leadership of the Councilmember and his team in spearheading this program and elevating the challenges of low-income working families in our city. I value the partnership that we have developed over the years and admire your dedication and compassion to serve not just the residents in his district, but residents across Los Angeles. I would also like to thank Councilmember Soto-Martínez for bringing new leadership and a fresh perspective to this work. I am excited to continue collaborating with the entire City Council, the Mayor, and all of our community partners to advance innovative solutions, not just to alleviate poverty, but to eradicate poverty in the city of Los Angeles. And I do want to take a few moments of personal privilege to acknowledge the contributions of our CIFD team, especially our Assistant General Manager, Veronica McDonald, and Aaron Strauss, our Senior Program Manager, and the entire Community Wealth team who's here as well. for all of their hard work. We also are joined this morning by some of our Family Source team members. We, as a department, we work collaboratively with 19 Family Source centers that are situated in the areas of the city with the highest concentrations of poverty. And our Family Source centers never shut down their doors during the pandemic. In fact, we had every program imaginable that was running out of the Family Source system, including the Guaranteed Basic Income, where they helped families apply for the program and help to onboard them. So I want to acknowledge the Family Source staff as well. It's also great to be joined by other community partners who are here, with United Parents and many other partners who have seen the success of this program and who challenged us to be bold and to prioritize the needs of low-income Angelenos. Thank you for your advocacy on behalf of our most vulnerable residents and for advancing economic justice in our city. The Community Investment for Families Department was established just a few months before we launched the Big Leap program. Our department's vision is to break the cycle of generational poverty by creating community wealth, which for us means ensuring that the federal resources that we manage are equitably invested in communities with the highest needs and creating financial empowerment opportunities for our most vulnerable households. Big Leap is a prime example of how we can directly empower Angelenos to take control of their own situations and make the best decisions for their families. This program supported 3,200 households living in deep poverty within the city of Los Angeles, providing them unrestricted monthly funds from January 2022 through March of 2023, which is when we last dispersed the monthly income. Our pilot was the first in the country to use public funds and created a blueprint for other cities that followed to also leverage public funds to launch their pilots. I've been involved with poverty alleviation efforts for over 20 years here with the City of Los Angeles, and I can say confidently that this is by far the most transformative program that I have had the honor to be a part of. We are also fortunate this morning to be joined by our fantastic team of academics who led the research for this groundbreaking pilot program and are now leading the research efforts for over 38 unique pilots across the country, over 38 programs in place now. And it's my honor to now introduce Dr. Castro, who is with the University of Pennsylvania, the Center for Guaranteed Basic Income Research, who is also joined by Dr. West and Dr. Kim, who Dr. Castro will also introduce, who will give us an overview of the pilot's key findings. Dr. Castro.
We're both a little bit shorter, excuse me. Thank you so much for coming out this morning. You know, there are two myths that I just wanted to dispel really quickly before we jump into the findings with Dr. Kim. The first is this myth, this persistent myth that innovation cannot happen within government, that innovation must happen in the private sector and then must be adopted by government. Big Leap has proven this myth wrong. Instead of saying we're going to wait for the outside world, we're going to wait for the private sector to address persistent income inequality and the persistent sort of ways in which lack of financial resources drives intimate partner violence, which then drives homelessness for low-income women. Instead, the City of Los Angeles said, we're going to tackle that head on and we're going to innovate within government. This is extraordinary. The second myth is that people who are living paycheck to paycheck, who are struggling to make ends meet, don't know best how to leverage resources. What Big Leap proves is that families, particularly moms, are best positioned to know best what their families need and what their kids need. And what we saw was that when we gave these households $1,000 a month, no strings attached, no means testing, they knew best how to create safety for themselves and for their kids. And the genius, the true genius of the Big Leap program lies in two things. First, the fact that it was embedded within government, within the Angelenos card. And so it was literally using the infrastructure that the city had already laid down within community, leaning on community partners like those who are behind us, in order to sort of root the program in a place and space that would make it work. Second innovation that was brilliant on behalf of the city was that they provided the guaranteed basic income directly to an individual. Unlike the CTC or the earned income tax credit, which goes to a household, Guaranteed income goes directly to an individual. What this means is that people who are trapped in situations of toxicity, intimate partner violence, or community violence have the power to make their own decisions about what they're going to do with their futures. So rather than the money going into a household that then has to be bargained over with amongst family members, it went straight to moms. And we saw these moms take that money and establish immediate safety by not only providing materially for their children in terms of food security, in terms of enrichment, but also directly attributing leaving situations of intimate partner violence and community partner violence because they received a guaranteed income through Big Leap. This is the first time that a finding like this has been established in North America since the Mincome experiments in Canada in the late 70s. That's extraordinary, and the City of Los Angeles ought to be proud of the way in which they innovated around this social problem directly within government, with public resources, with public backing, and in partnership with community-based organizations. And with that, I'm going to call up my colleague, Dr. Kim, to run through some of the findings. Thank you.
Hi, everyone. So I'll give you some brief overview of the findings that we found through this study. First and foremost, guaranteed income had a positive impact on financial well-being of people who received guaranteed income for 12 months, one of which was that people's ability to cover a $400 emergency expense. Families with children have a really difficult time covering these emergency expenses, and we saw that people who received guaranteed income in the city of Los Angeles were significantly more likely to be able to cover this cost. People were also we also saw improvement in health in terms of being able to put food on the table. We saw a significant reduction in food insecurity among people who are receiving guaranteed income. We also saw that people were engaging in more health-promoting behaviors. And like Dr. Castro mentioned, that significant reduction in intimate partner violence in terms of severity and frequency across the study period. We also saw that people were becoming better parents. They were able to spend more time with their kids. They were able to provide more quality attention to the kids. And especially in the quantitative findings, we saw a significant increase in participants more willing to put kids in child enrichment activities, extracurricular activities, sports, and whatnot. We also saw that people saw an improvement in their community environment. They saw that there was a reduction in perceived community fear of community violence, but also an increase in positive interactions with neighbors. And that meant that GI recipients were also sharing their GIs with their social networks to relieve poverty elsewhere. We also saw a positive impact in employment. Unlike what we fear about having a guaranteed income would reduce people getting involved in employment or the labor market, that was definitely not the case. We saw that the treatment group who were receiving guaranteed income were much more likely to secure full-time employment than be unemployed and not looking for work compared to the control group. Thank you.
Thank you, Dr. Castro and Dr. Kim. It is now my honor to introduce Ashley Davis, who has joined us this morning. Ashley is a participant of our Big Leap program, and she has been engaged with us, and we appreciate her being here. We did engage in a pretty robust storytelling process where we brought together the participants every couple of months to keep up with them, to talk about some of the challenges that they were having and opportunities that this program created. So it's so wonderful to have Ashley with us this morning, and she's going to share her own perspective as a participant of this program.
Thank you. Good morning. I want to start by saying that I am very thankful that I was able to participate in this program. I might get a little emotional, but once you hear my story, you'll understand why. I'm a single mother of a special needs child, and I worked full time, and it was just so difficult for me to keep up with the duties of being a mother and also working full time while still trying to provide the needs, the special needs my son needed. The extra income definitely helped me. Times where I probably didn't know where the extra money would come from, or if I had an emergency, that income helped me. I wasn't stressed about it like I probably usually would be, but I was so thankful to be able to take care of the surprise expenses, because most likely in the situation that I was in, I probably wouldn't be able to do that, or I might have had to add it to credit cards, which would have created more debt for me, which would make it harder. This income did allow me to focus more on him. He needed about 40 to 50 hours a week of therapy, which was tough for me. And I remember saying to the therapist, when exactly am I supposed to work? Because if I can't work, I can't take care of myself nor my family. One of the things that I was really struggling with was neglecting my own needs. I started to become unhealthy, gain weight. My sugar levels were increasing, becoming high, which put me at risk of becoming a diabetic. So I was pre-diabetic. Cholesterol was going through the roof. And I thought I was doing everything that I could do to stay healthy, but a huge part of it was I was making sacrifices with the type of food I was purchasing because of my budget. So the help allowed me to buy more healthier food options, fruits, vegetables, smoothies, juices, to make sure that we were receiving the nutrients we needed to stay healthy. So my A1C number has dropped, thankfully. One of the things that I am extremely proud about, I switched careers. I went back to school. Because of this program, I was able to ace every single science prerequisite I needed to get into nursing. So I'm now in nursing school. Because we were also dealing with COVID, there were times where I was sick and I probably couldn't get out of bed, and I still would get up and try to go to work. And I remember telling myself, like, hey, you have the extra cash, rest. I think that a lot of us don't receive the help that we don't know we need, and we're focused on trying to get things done because that's our job as parents, and sometimes we're afraid to ask for help or reach out for help. So I am so thankful to be able to take part in this program because I was one of those people who really needed it, and for the longest I wouldn't accept that. So I'm thankful. Thank you.